The figure 1, the critical elements of professional communication. Show respect. Use titles Miss, Mrs., Doctor, unless otherwise stated. Respect the clients, caregivers, supervisors. Don't waste people's time. Be mindful of body language. Number 2, be organized. Organize your thoughts before you speak. Have goals in mind. Bring notes, data, visuals. Rambling is unprofessional. Number 3, use professional tone. Adjust your jargon based on your audience. Professionals may feel insulted if you oversimplify. Parents may not understand. Number 4, listen to understand. Listen for content and emotion. Don't lie. Give false reassurance. Don't stress. Stay neutral with the prognosis. Number 5, attend to context. Consider who you're talking to, where you are, and what feedback you're receiving. People may be uncomfortable sharing with strangers. Number 6, modify based on the feedback, because miscommunications can happen. Look for verbal and nonverbal cues. If someone is confused, address it. And number 7, the importance of experience. Adults care about interpersonal and technical skills. Counseling gets better with practice. How to show respect in spoken communication. Use formal titles with adults. Respect their experiences. Maintain dignity, especially when communicating with clients who have disabilities. Be considerate. How to avoid being organized in spoken communication. Have clear goals, structured thoughts. Give them any needed materials. Have them be ready. How to use a professional tone. Adjust to the listener's knowledge. Define your jargon. AIDET. Acknowledge, introduce, duration, explanation, thank you. Acknowledge, introduce, duration, explanation, thank you. AIDET. Acknowledge, use names and acknowledge everyone present. Introduce, give your name, position, credentials. Duration, tell them how long the interaction will take. Explanation, explain the purpose and steps. Allow questions. T, thank you, explain with gratitude. So informational counseling, educating about the disorder, the severity of the prognosis, what happens during evaluation and a treatment. And if you don't know something, research and follow it up. What is the purpose of a diagnostic interview? Obtain information, and provide counseling as needed. A diagnostic interview with parents versus adult patients. Parents, they may include a case history, or you may need to double check it, ask questions based on concerns, the child's age and disorder, and prepare bullet points before starting. When it comes to adults and families, maintain dignity, speak to the client, not about them, include them as much as possible, verify family information with the patient. Steps for discussing evaluation results. Give results, interpret results, provide recommendation and prognosis. Tips for increasing retention. Be specific, use simple language, give important information first, emphasize the key points, announce the order of information, repeat the most important details. If you have visuals, use them and don't overwhelm the people. How to train for homework. Homework builds retention. So the steps are: outline the technique, 2, demonstrate it, 3, have a patient or family try it. So homework builds retention, outline the technique, demonstrate it, have patient or family try it. Discussing progress tips. Give data over time, explain reports since they can be confusing for families, show graphs or charts, review the goals and decide if they need adjusting. Figure 10-2, counseling about treatment issues. Identify issues, articulate the issues, ask client for solutions, add clinician solutions, agree on a joint plan, monitor and follow up. Figure 10-2, counseling about treatment issues. Identify issues, articulate issues, ask client for solutions, add clinician solutions, agree on a joint plan, monitor and follow up. Personal adjustment counseling, helping a patient or family process and cope with the information you give them. Listen deeply so they don't feel dismissed. With whom do we interact professionally? We interact with clients, caregivers, families, supervisors, other SLPs, teachers, physician, nurses, psychologists, insurance. Types of professional communication: consultations, meetings, collaborations, written correspondence like emails, letters, and reports. Professional communications, consultations, meetings, collaboration, written correspondence, emails, letters, reports. Consultations, discussing a case with another professional to share information or gather insight, two-way information. Consultations, discussing a case with another professional to share information or gather insight. Meetings, formal discussions with teams about client progress, services, and goals. Collaborations, working together with other professionals to support the client's outcome. Common issues when speaking to other professionals: using too much jargon, time constraints, unclear roles, conflicting recommendations, or communication breakdowns. General tips when speaking with people from other cultures: be respectful, listen first, observe nonverbal cues, avoid assumptions, confirm understandings. The evolution of the supervisor or supervisee relationship: start structured and directive, become more collaborative as the student gains competence. Supervisor task: guide, teach, model, provide feedback, ensure ethical and effective service delivery. Supervisor task: guide, teach, model, provide feedback, ensure ethical and effective service delivery. Expectations for students: be prepared, be professional, accept feedback, communicate clearly, demonstrate growth. Common supervisor issues are miscommunication, unclear expectations, poor organization, insecurity, and avoidance of feedback. Common student mistakes are not asking questions, lack of preparation, defensive reactions to feedback, disorganization. General differences between boomers, Gen X, millennials, and Gen Z: they have different attitudes toward authority, communication style, technology use, and expectations in professional settings.